Interdisciplinary Early Childhood Related Services Personnel Preparation, or INSPIRE, is a program that trains occupational therapy, physical therapy, and speech-language pathology scholars to effectively collaborate on an interprofessional team. Our scholars are trained to provide best practices in early intervention and early childhood, or EIEC, for children and their families. During the COVID-19 pandemic, the hands-on nature of this interprofessional education program transitioned from a hybrid educational delivery format to an all-virtual format. As the pandemic environment changed, we gradually returned to a hybrid format with protocols following CDC guidelines. This poster highlights modifications in educational service delivery for the Interprofessional INSPIRE course.
Training includes synchronous and asynchronous instruction, in-person lab experiences and workshops, completion of an electronic portfolio, and clinical rotations in early intervention and early childhood programs. As part of the lab training, scholars observe an arena-style evaluation conducted by local EI providers and collaborate on an interdisciplinary team to administer EI and EC assessments to a child between 6 months and 3 years of age. In 2019, these lab days were held in person with all parties attending, including the EI providers and families.
COVID response. In 2020, as the COVID pandemic was developing and closures were in place, the INSPIRE teaching team used creativity and technology to provide the same experiences in a modified way due to the pandemic. The focus shifted from a hybrid model to a virtual one with a focus on maintaining the integrity of the program. During asynchronous learning in the pre-pandemic time, students completed weekly assignments, readings, and quizzes, along with case studies and online discussion on their transdisciplinary student teams. For the pandemic modifications, nothing needed to be changed as this was an asynchronous learning opportunity. For our synchronous workshops and clinical labs, pre-pandemic, the students observed the arena-style assessments in person, administered in-person assessments, and also attended workshops. The pandemic modifications included changing the in-person nature to watching the previously recorded arena-style assessment, practicing a telehealth arena assessment on their transdisciplinary team, and attending Zoom meetings. Clinical rotations in EI and EC pre-pandemic were local, regional, or national placements at EI/EC practices, and during the pandemic, it was modified to include telehealth placements and clinical simulations.
Outcomes. The virtual experiences afforded new connections, as project directors were able to reach outside of their local region to include families and practitioners from outside of the state in the scholars' training. Scholars gained valuable practice working on teams and with children and families using a telehealth model. The scholars utilized multimodal teaming skills, including written, in-person, and virtual communication. These experiences allowed for effective education, continuing the aim of the INSPIRE model, while also contributing to a seamless transition back to a hybrid delivery model.
Discussion. Students in an IPE training program benefit from varying types of educational service delivery, including synchronous and asynchronous learning, hands-on experiences, clinical placements in EI and EC, and reflective writing. The project directors intend to continue training in telehealth even after the in-person components resume. The hybrid nature of the training program allowed for seamless transition to and from an all virtual format during pandemic closures.
Future directions. Currently, the second cohort of students are in this interprofessional training program, and the third cohort has been admitted to begin in September 2021. Our lab day will include an addition of a telehealth intervention session to extend on the telehealth transdisciplinary assessment that the students completed previously.